Hi, and good afternoon, everybody, on this beautiful, maybe not so beautiful day here in Newfoundland and Labrador, broadcasting to you live from St. John's, Newfoundland. Wow, I've been inundated with numerous stories from across this island and across Labrador about what is going on with healthcare. There's a lot of reasons for us to be concerned about what is going on with our province and how are they handling budgets. Just something that came on the radar recently that everybody should know about. I believe there was $541,000 given to a private contract for ambulatory support here in Newfoundland and Labrador. I believe 6 days before the last election, tabled by Premier Hogan at the time. And to be honest with you, none of us are seeing an improvement in ambulatory care. We've had stories on about our friend named Lou, who's had to come in twice over the highway, once in the middle of the night when his wife was septic and it was life concerning. And yeah, these things are happening. We do know now that when we apply public pressure, it seems to be that they give us a little nugget here and there. Thank you to the province for giving us 2 new MRI machines. Now let's see if they make a difference. So today we've got a story from out in the Buren area. It's a wonderful lady named Mary Lindaham and her partner Derek, and their experiences in the Buren area. Their story reaches back to sometime in March 2026, and I am going to bring her on board so that we can have a conversation. Hi, Mary.
Hi,
How are you today?
doing okay.
You've been through quite the story, hey?
Yeah, it's been a rough month or so.
Yeah, and you live in Buren with your partner. Do you live with your partner?
Yes.
Okay, and you have a tell us a little bit about you. I believe you have a background in healthcare too.
I am a home care worker. Been one for probably about 6, 7 years. I've, well, I've taken care of many clients from diabetics to Alzheimer's patients to COPD patients to cancer patients. So I've got a little bit of
Background in taking care of the people that need it the most. Well, thank you so much for your service to the community. But you've got a story now that's hit home. Why don't you tell us a little bit of a background of what you've been through?
Well, my partner was seen by his family physician, who I have to say is an absolutely amazing doctor.
That's good.
And we're very lucky, very lucky. We had some concerns. Um, he had previously had fluid on his lung, and he was become very confused, delirious, and I had concerns that the fluid was back on his lung as well. So they felt he needed to be admitted to hospital. And his doctor got on the phone to the hospital, let him know the situation, and to prepare to have him admitted. So we went on to emerge from there, from the office. Uh, he was seen. He actually, at the same time, he had a pressure ulcer on his heel from,
A
I
pres-
guess, uh, yeah, it started as a big water blister, actually, on his heel from, I guess, the fact where he was his mobility issues with
okay.
the confusion, and he was pretty well lost mobility, and as you would, dig your heels in to try to move yourself around, which caused
Absolutely.
that. And he also had a history of peripheral arterial disease, so which is poor circulation.
Okay.
It's an
Not a
easy way to say
diabetic
it.
though. He's not a
No,
diabetic. No.
no, he's
Just
not a
circulation.
diabetic, but he do have circulation issues. So we went to Emerge. They done all kinds of tests, whatever. They X-rayed his. No, that was the next day. Sorry. They bandaged up his heel. He was admitted on the 16th of March.
This is what it
Uh,
looks like. This is what his heel looked like when it was.
Actually, that picture right no, that picture right there was from his last admission on the in April.
Okay,
So
so would
this,
it be more like this one?
yeah, no, the one with the black, all black. That was
Okay.
his first
This was
time.
his first time.
Yes,
This one right here.
yes, that's what it looked like when he was discharged after the 7 days. He was
Okay.
admitted for 7 days at the time. Um, he had once the confusion and everything, which we figured out was due to a medication he was on. He was interacting with another one. Um, and he did have to have his lung tapped again because what was a pleural effusion now had become a hydropneumothorax, which was fluid and air in his lung, and the pressure ulcer. So I guess the only way I can see is that the pressure ulcer took the back burner.
The foot took the back burner to
Yes,
his
the foot.
lung issue. Okay.
Yes, the foot took the back burner, as far as I'm concerned. They bandaged his foot and emerged that day, and the foot wasn't even looked at or bandage changed on it. That was, let me see, 16th of March was what day? A Monday? Yes, I believe it was Monday.
Hmm.
Foot wasn't even looked at or the bandage changed on it until Thursday
And is
of
this
that week.
picture with the bandage when was this? Because that doesn't look like it's
Thi-
bandaged very good.
This was in April, those
Okay.
pictures.
Okay.
Uh, the day he was discharged from hospital for that 7 days, the, it looked like the first picture that I sent you, the one with just black. Yes. That was the day previous to his discharge at hospital. He was
Okay.
discharged from hospital on the 23rd of March with the foot looking like that.
Wow.
There was no bandage done to it. They left it like that. Uh, there was no referral to community health for
No, they
wound
never
care.
even they weren't even sending out a health nurse to address it or wound change or
No,
none of that stuff.
no, nothing, nothing. There was no referral for community health for to see to it, wound care, nothing.
So what happened from
So
there?
from well, I mean, according to them, I mean, I was good, right? You know, that was my
Well, not
first.
really.
That was my first real experience with having anyone in hospital. So what you don't know kind of thing at the time.
Mm-hmm.
Even though, I mean, I
Well, that
tested,
looks dangerous.
yes. So he was home. Well, actually, we got to backtrack for a minute because the 7 days that he spent in hospital was absolutely unreal this first go round. From being left with dirty diapers for 12 hours.
No.
And, oh, absolutely. That
So
happened
they
at least on three, if not four occasions out of the seven.
so he was left for 12 hours to sit in his own soil.
Yes. I would, before I would leave at 8:30 in the night, I would give him a wash, change him, and get him ready for the night. And I would be there. I'd go there 8:30 in the morning. I'd leave at 8:30 in the night. I ended up having to lose work for the evening. But I mean, you do what you got to do.
Well, I mean, if he's going to be left like that in the hospital, you're going to have to be there, right?
If exactly, if you don't, you need somebody with you because, let's say, and I got to the point where I actually would mark his diaper so that I knew the next morning
If he was
and
changed or not.
if he was
Gotcha.
changed.
And it wasn't.
Well, it wasn't. And I did speak my mind to the nurses. I got very upset. And I went as far as to say to him, this is uncalled for. It's ridiculous if I don't listen to a child or I brought him here like that or somebody came into my house and found him like that. I would be on charges for neglect.
Oh my God, they take your children away.
Absolutely would. So why is it okay in a hospital?
Well, it's not okay in a hospital. That's the problem. But
No.
the accountability part seems to be something that we're all struggling with. Like there's been people that I heard a story this morning about a young man who appeared in the hospital for a mouth infection and a pretty extreme mouth infection, stayed there for like, I think it was 15 hours and died as a result of this mouth infection in Emerge and
Right.
left behind two small children. So, it's not an isolated situation. I don't know if it's a systematic error or lack of supports, but there's something seriously going on in our healthcare system to allow, like with this picture right here. Did he go home like that, or was what
Uh,
did he get here?
this was, well, in April. He came home from hospital on the 23rd of March. I kept it because I didn't like it, so I kept it bandaged as best I could with what supplies I had and what I borrowed off of other people that had supplies.
So they didn't even give you
So
anything for at home care. Nothing. Nothing.
nothing, absolutely
Wow.
nothing. And on the 12th of April, I was like, okay, this is enough. You're going back to the hospital. Like something has to be done. This is not, you know,
Wow.
not good enough. This is going next thing,
You're gonna lose your
I
foot.
was I
Yep.
was very concerned, like I mean, afraid it was getting infected or I was keeping it bandaged the best I could with what I had. And by the 12th of April it was painful. He wasn't able to put no pressure on it anymore. Because up on the day he was trying to walk around them, which obviously can't be good anyways to start with. So I brought him back to the hospital. He was seen. Actually, I had to get an ambulance to take him back because I wasn't capable of trying to get him into the car because he couldn't
Mm-hmm.
put no weight. He had mobility issues to start with, so you know. And this picture that you see there, that is what it looked like the day he got discharged from hospital on. Let me see. Oh gosh, I don't even remember the dates. It's been such a the 11th of April, he went in there, and I believe he got discharged on that Thursday. Let me see. He got discharged from hospital on 16th. That's what it looked like on the 16th of April.
Now, did they give home care supplies or a care treatment plan or anything at that point in time, or was it another situation where they just sent you home and you had to figure it out?
Well, this time around, the surgeon had took him into the OR on Sunday. Actually, in Emerge, it's a long in Emerge, the surgeon wanted to take all the dead tissue off it in the emergency room, in the cast room.
Okay,
And thank God for the nurse that was on because she spoke up to the surgeon and said, absolutely not getting done
okay,
here. Like she said, it needed to be done in a sterile environment
absolutely.
because of infection control and everything else. She fought for him, and they ended up admitting him
So they were going to
because
send him home again. They were going to just
I'm
take him in
assuming so.
in the
I'm
cast
assuming
room.
that was the plan.
Wow, they were going to just
I'm
take him in the
assuming that
cast
was the
room,
plan.
scrape off the dead, and send him home.
I'm assuming that was the plan. Because why else? What were they going to do it in Emerge if it wasn't to do it there and send them home?
Wow, that's
Right.
like mind blowing. That's scary. So he got admitted into hospital, and then what happened?
Then the following day, which was a Sunday, they took him to the OR and took all the dead tissue and everything, all the dead off, skin off it. Well, actually, they did leave some of it, but they took the big off it. That was Sunday, and rumor had it in the hospital on Sunday that they were going to discharge him on Monday and have
That's
him
it.
come back and forth 3 times a day for IV antibiotics.
They've the last time I checked, I've got another person that reached out to me that's a good friend who is in kidney failure and requires dialysis, and he has these abscesses that are exploding inside of his kidneys, so it's
Yeah,
really bad. They admitted him. They couldn't admit him. He spent 5 days on a stretcher in the hallway. Then they sent him home, which was very stressful on his family because they're afraid he's gonna,
absolutely.
something bad's gonna happen. The kidney specialist said, "I'm not comfortable with sending you home, but I have no choice." And it was that they were waiting for like 26 beds for like people that are very sick. So what they're doing, what I feel like they're doing is that they're getting people in for the shortest amount of time possible and just shoving them out.
Absolutely. It's absolutely mind blowing what's going on inside of the healthcare facilities.
So they were going to just have surgery. What date was surgery? And they were going to send him home on Monday.
Yep, they done surgery on Sunday, 10:30 in the morning. They took him down to the OR
Mm-hmm.
and they done the surgery to remove it all. And rumor had it that evening, I was told that they were going to discharge him on Monday. And I was like, absolutely not happening. Like, if he has to have IV antibiotics, like,
Well,
I
you got to
am
go through
not.
the whole process of getting back in there again and
Well,
seeing if they'll let you come back in and if there's a bed available.
exactly.
Yep.
Well, you'd have to, if they weren't going to keep him admitted, that would involve me having to take him from home and back and forth to the hospital 3 times a day to get hooked up to IV antibiotics and brought home again and brought back and brought home and brought back and brought home.
Yeah. And
But
there's
with a
no,
person that can't put no weight on their foot.
yeah. And the price of gas too. Like,
Right.
let's think about that. It's expensive if you live far away from the hospital.
Yeah. So Monday morning, the surgeon came in to see him. He said to me, he said, "So you're home with him, right?" I'm like, "No, I work Monday to Friday."
Mm-hmm.
"So who's home with him?" I said, "He's home by himself." "Oh," he said, "well, we'll keep him for a couple of days." I said,
Okay.
"Yeah, you will. You will."
Yeah, it's going to happen whether you like it or not, or we're going to kick up a stink. Lots of people have had told the hospital to go ahead and call RCMP to have them taken out of there. That seems to
Well,
be
actually,
what works.
Monday night I lined up 3 people in case I needed to get bailed out of jail because I was expecting to get get
You were
locked up
expecting to
or
get
get
arrested.
arrested. Yeah, because I wasn't putting up with it, especially after what we went through when he was previously admitted. And Monday morning, after his surgery, and I went in and I find him peed out through everything again.
Okay, so that now we're admitted in hospital. He's had his surgery. He gets to stay for a
Yeah,
couple of days after you fought for it a little bit, and now you're finding that the in care in the hospital, he's still
yeah.
being left in his own waste.
The next morning after his surgery, he had his surgery Sunday. So, I mean, Monday I goes in 8:30 Monday morning. He is wet out through everything to the point through a diaper that they had him in. His clothes, a soaker pad, and the bed linens. Everything.
And how long have you been like that? You figure?
I would imagine it must have been overnight.
Like, there's a certain amount of dignity too, like these people have feelings, and they're respectable men, and they've worked their life, and they've paid all their taxes, and they've done everything that they're supposed to do. And I'm sure Derek doesn't appreciate, like, I'm sure he doesn't want to be in that bed, that he'd much rather be up and being active or doing what he normally does. But to let him sit in his waste, how disrespectful, to let him stay that way.
Well, I mean, I see somebody made a comment there, I'd be savage. I was savage. I was a savage that morning because I went in around 8:30 to go give him a wash and get him ready for. I would go in every morning when he was in hospital for 8:30, help give him a wash and get him set up for his meal, his
Mm-hmm.
breakfast. And when I took back the sheets and I see the state he was in, I was like, Derek, I'm sorry, but I'm not having this. And I lost it. I covered him back up. I hauled back the curtains on his bed, and I was like, there was two nurses or staff members. I don't know if they were nurses, if they were PCAs, who they were, but there was two there giving another gentleman a wash. I'm like, no, not happening, no more. You can deal with this. And I gave him
You
all.
laid out the
I,
law.
I gave him a piece of my mind, and I'm
And
not one to. I'm pretty easygoing,
well, and I mean,
but
especially where you're in the healthcare. Do you know what I mean? Like, that's what you do. And as a home care worker, you're the one that helps people at home. You keep them clean. You help them clean up their
yeah,
house. You make sure they're
exactly,
fed. So the hospital is supposed to be the place where you go for safety, where all of those things are
exactly,
supposed to be taken care of. That's why you
exactly,
want your family admitted in a hospital because it's care beyond your scope. And
exactly.
so what happened? Please tell me it didn't happen again.
Oh no, it didn't happen after that. It did not happen after that. They, I think, for the next couple of days that he was there, I think they made sure he was washed and changed and everything before I got there.
They were like, "Oh, she's coming," right?
You know, I can only imagine, but that's it. You got to fight for, you know,
Well, and the sad part is, Mary, it's like I'm a troublemaker, clearly, right? So when I went and my mom was going through her hospital journey and she was dying and they knew who I was, obviously, right? It's not my, I mean, they made hospital laws for me protesting outside the hospitals, which I was definitely not on hospital property. I was at the end of the parking lot, whatever. But anyway, um, I felt they tried their best for me because they didn't want the pushback, right? Because I have a large following. And then we just did Lou's story a little while ago about him
yes,
waiting and have to
yeah,
drive his wife over the highway in the middle of the night at 72 or 73 years old. Like, are you kidding me?
it's
Um,
crazy.
but then when he went to the hospital the next time, they fast tracked him, right? And I'm proud of the fact that sharing his story has gotten better care for Olive, because they don't want the pushback. The video that we did for him, I said, I think was seen like 100,000 times, right? So now they're like, Olive is getting the treatment that she needs. But I said to Lou, I was like, well, what about the other 30 or 40 people that are sat in the waiting area? Like, we shouldn't have to fight for this stuff. That's what we pay
No.
tax for, you know? So, how is Derek doing now? Like, where are we now?
Well, we finally have community health taken care of him.
Okay,
Finally.
good.
Um, he was released from hospital on Thursday. Um, community health, and actually, the day he was getting discharged from hospital, the dressing on his foot was all seeped out with blood and discharge.
Is that the
And
picture
I
that I have where it's kind of half?
no, I never sent you the picture of that. Oh,
Okay.
that was that one without. Oh, this here was what I came in to see on Tuesday morning when I went in.
So, when you went in on
With the band,
Tuesday morning, this is what it looked like.
this is what it looked like. It was the bandage had coming off sometime during the night because there was there was discharge on the pillow that was under his foot. That's what I came in to see Tuesday morning when I went in 8:30. And I said to him about it. Oh, he said we'll get around to changing that at some point today. Now you can see there that gauze that's on the bottom of the stuck into that.
Yep.
That is the roller gauze that is on the outside of the bandage. That's to cover it. So that roller bandage is obviously touching against the dirty bed sheets,
Yep.
right? Is now
Yep.
stuck
Bacteria and
into an
infection. It's wide open.
yes,
And
stuck
hospitals
into
are
an open
known
wound.
for being worse, right? Like because
right?
there's so many germs in the hospital, they say it's
Yeah,
worse to be in there.
yeah. So that was the gauze that was on the outside covering the dressings is now stuck into the wound.
Wow.
And I said to him about it. They said, we'll get around to changing that at some point. It was 2 o'clock in the afternoon before the bandage was changed and the dressing changed.
From the
From,
morning.
from sometime probably the night before, I guess he had rubbed it off from moving around in the bed.
Yeah. I mean, I don't think it would be that hard to change. I mean, I went through some of these things with my mother and various people. It only takes what, like minutes
Five
to
minutes?
up. Yeah, at least cover it so it's not going to
Yes,
get more prone to infection or
yes,
become worse, right?
yes. I ended up, there was a bandage there on his night table. I ended up covering it until they got around to it.
So you fixed it. You fixed the problem. That's crazy.
Well, I just put a bandage over it just to cover the open wound until they got around to changing it.
Wow.
That was
Wow.
Tuesday. That picture was taken.
And how are we doing now?
Uh, well, you got discharged Thursday. I called community health on Friday to see when they'd be getting around to see him. When I finally got a hold of them, they weren't even after receiving the referral from the hospital.
He what?
They did not receive the referral from the hospital. Community health had to get on the phone with the hospital and get the referral sent to them.
Because they didn't even have one for him yet.
They didn't even have it.
Wow.
This was 4 o'clock Friday evening, and community health, well, normal hours was till 4:30 in the day. At 4 o'clock in the evening, they had to get on the phone with the hospital and get the referral sent to them because they didn't have it.
That's crazy. So
And
now,
5 o'clock that evening, there was a nurse here changing the dressing on this boy.
yeah, well, because they kind of have to then, because
Yeah,
they showed that they dropped the ball, so they have to kind of show up now and get it rectified so that you don't make a stink,
yeah,
right?
yeah. So community health is taking care of it right now. They came and changed the dressing on a Friday. They came again Saturday, and they came again Sunday.
Okay, so the community
Um,
health people seem like they're on the ball.
yes, and they left me a ton of bandages and dressings so
Okay.
that I can change it myself. They showed me what to do and told me what to do and what dressings to use, and we have it set up for them so that I get off work early on Fridays. So they wanted me to be here. So we have it set up for them to come Fridays to look at it. So I change the dressings in between.
Okay, and they come by and just make sure
Um,
everything's good.
yes, unless there's any concerns, if he runs a fever or any sign of infection or anything like that, I'm to call them immediately.
Okay.
So the community health nurse came on Friday and looked at it. Now she is concerned about it because there is exposed bone.
So all the padding's gone. It's all died.
Yes, yes. And you can actually, on the last picture, the one the day he was discharged, you can actually see where the exposed bone is.
Is it this one? No.
No,
This one?
that one. You can almost see where just down below those two holes, kind of.
Yeah, these two?
That
Yeah.
that is bone.
Wow.
Almost. I'll explain to you like this. It looks like the end of a chicken bone. Those two knobs.
Yeah, that's what it looks like.
That is bone.
Wow. So what's going to
So
have to happen? Did the surgeon say that anything had to happen, like reconstructive surgery or?
well, honestly, the surgeon didn't tell us anything. The surgeon never even looked at it after he debrided it from the time he was discharged.
So there was no follow up from the surgeon? That's not
He
normal.
has a follow up. He has a follow up appointment for the 2nd of June.
The 2nd of June. Mm.
But now the community health nurse is going to be said that she's going to be getting in touch with him on Monday
Yeah,
because
like
there's
she'll
no,
probably liaison for you and
yes,
advocate on your
yes,
behalf.
because there's like she had said there's no way that will heal with exposed bone.
Like this is totally unacceptable.
It
It,
is
it
absolutely unacceptable.
so like some of the things. There's a group here in Newfoundland called Together for Newfoundland and Labrador, and they're taking a stand
Yes,
against healthcare because it's like, okay, so we've got a $500 million that's gone for ambulances, but we still don't have any ambulances. We are paying travel nurses to come to our province. Meanwhile, our own nurses are travel nursing, which increase the cost, just so
yeah,
that the government officials can kind of keep people in their rentals that they've got. Doctors are still not doing in-person visits because that's, I think, what killed my mother partially, outside of the bad drugs. Do you know what I mean? So, like, I don't know what it's going to take here to be able to make this better, but I do think that applying public pressure to our health minister. So far, Lena, I can't remember Lena's last name right off the top of my head, so forgive me, folks, for watching. But she seems to be paying attention, right?
oh, the health minister,
Yeah, she seems to be
Layla Evans.
yeah, she seems to be paying attention. I don't want to say anything negative about her because, she's got a couple of MRI machines. We have yet to speak with her. But Together for Newfoundland and Labrador is compiling a list of what needs to happen in order to be able to apply public pressure to get the answers that we need because this can't continue.
It can't.
Like, it really
Pub
can't.
the people are suffering and dying.
Yeah. The hospital, you can't even find a spot in the parking lot. Like I've had to walk from the bottom of the parking lot. I'm like, what is going on in Newfoundland? Why are there so many people sick? And you know what? Lack of care escalates things, right? So you can have an infection, a chest infection. If you can't get to see your doctor, it goes into pneumonia. You know what I mean? Or if you get discharged like Derek did and sent home and it's not properly cared for, like you're a home care worker, at least you know what you're looking at. Do you know what I mean? You've seen other people in similar situations. What about the people that are home that don't have anybody? What about the people that don't know like that are even afraid to look? Some women out there would be like, "Oh my God, I can't
Oh
look at
yeah,
anything. That's not my thing. You've got to find me somebody, that's going to be able to help me out." So these are the things that Newfoundland and Labrador really needs to start advocating for. I know that we're going through a lot with like finances and all these other things and inflation, but like if we're not healthy enough to do anything, then we're done.
yeah.
The health of
I
Newfoundlanders and Labradorians is paramount, the ultimate first thing that needs to happen.
I think a lot of it has to do with putting the money in the right places.
I think so too. And making sure the money goes to the right places and that money just isn't going because like with this contract that was given to the ambulatory people, get this, it wasn't even put on a tender. So
I
normally what
know.
happens is the government will put out a tender and different various private or whatever people can bid on that contract. It didn't even happen. And it happened like 6 days before the election so that people didn't even have a chance to pay attention to what was happening. We just had $500 million injected into our ambulatory program and we have 73-year-old people driving in over the highway at 11 o'clock at night because their wives are going to die from sepsis if they don't get them where they need to go.
And actually, I'm enlisting. I don't know if it's still like it, but I am originally from Trapassi on the southern
Mhm.
shore on the Avalon Peninsula, and we are 2 hours. My hometown is 2 hours from St. John's, and if you need to go for a doctor's, well, any tests or anything like that, it has to be St. John's.
Yep.
Practically, everything is St. John's for us, which is 2 hours away, and especially in the wintertime, it's not nice to drive.
You need an ambulance though. Like ambulances need to.
And they actually took one of the ambulances. There was two at the time. Now, this is a few years ago. I'm really not sure if it's changed or not. There was two ambulances in Trapassi at the time, and they took one of those from them and moved it halfway between Trapassi and St. John's.
Okay, so you guys are down one ambulance.
If they were. So
They
if
were.
that ambulance has to go with somebody, I hope you don't have a heart attack or a stroke because you got 2 hour wait for an ambulance to get back to you probably.
Well, that's like Lou's story. Lou was 15 kilometers away from the hospital and
Yeah.
waited an hour and a half with his wife unconscious on the floor for an ambulance. 15 kilometers. I can do that on my bicycle
It's
faster than,
crazy.
you know?
Yeah.
Well, Mary, thank you so much. Is there anything you'd like to tell Newfoundlanders and Labradorians about, anything you want to say to inspire them or things that they should watch for?
Well, really, all I want to say is don't be afraid to fight for your loved ones. Don't be afraid to speak up because, I mean, I don't know if it's lack of staffing or what it is, but our healthcare is in a major, major crisis. And without,
Major,
and I mean, if somebody is in hospital and can't speak for themselves,
they're finished. They're
you know,
finished.
it's crazy.
Yeah.
I was there like, well, first 7 days first time, and from Sunday to Thursday, Saturday to Thursday the next time, and what I seen was absolutely out of hand.
Yeah.
The whole time I was there, I would go there 8:30 in the morning. I would come home some days for probably about 2 hours in the afternoon, and I would go back to be there till 8:30. I would be there, three other people in the room with Derek. I was tending on all of them.
You were taking care of other patients.
I was tending on all the patients in the room, in his room,
Oh, that's crazy.
because it
Somebody had to do it.
somebody had to do it,
When my
and
mom
I
was in,
couldn't be there and see them wanting something or needing something. Like supposing it was a glass of water. I mean, if there's nobody there to get it, they have to depend on a nurse or a staff member or somebody to get it for them.
when my mom was in hospital, I had to feed the lady that was in her room because she couldn't sit up. She was having abdominal, like my mom was put in the, like with a group of women when she was dying with cancer. And this lady couldn't sit up because whatever she had going on with cancer and stuff was in her lower abdomen and she couldn't sit up. And they would come in and they'd lay the tray on the thing and she couldn't sit up to get anything, and we're talking it's like
Yeah,
soup, okay,
yeah,
soup, orange juice,
yeah,
whatever. So myself and my dad and other people had helped her over the time to kind of get her fed. She said because
yeah.
like she couldn't do it and then they just come in and take the tray and go.
Yes, I seen like I done the same thing in there. I would set all four of them up for all their meals. I would make sure I was there for breakfast, dinner, and supper. And there was one gentleman there that I used to actually help feed.
Wow, that's crazy. But you're a wonderful person, and Derek's very lucky to have you. And we're very lucky to have had the opportunity to kind of, you know, amplify your voice and get to hear a little bit about your story. I'd love if you follow up with us in the future to kind of let us know how Derek is doing. Or if you need us to go on our soapbox and shout on the internet, we're here for that too, right? If you
Uh,
want us to
somehow,
tap some
somehow,
bums,
I don't think I'm going to have to worry about that from now on because now as I say, they poked the bear,
yeah, there's no
and
real
when
going.
there's no going back now for me. I'm normally not. I'm pretty quiet, mellow person that wouldn't dare say anything against a doctor or a nurse because they're the ones who's supposed to know what's right and wrong, right? And you
Yeah,
don't
and
question them.
some of it's their some of it is their issue, but other is some of it's supply, not enough staff,
Yeah,
these types of things. There's so many factors that we're being failed by, you know.
it's a combination of everything, really. Because I know at one point there was only four nurses on staff. They had no PCAs to assist help them. So I mean, what really? I can understand what is four nurses supposed to do for 22 patients,
Nothing. But like
right?
you can't keep up with that.
But I mean, you know,
They got to
people in
try,
hospitals
or
still don't deserve.
they have to advocate for support. They
Yes,
have to advocate for support. They have to go back to their employers, which is, Newfoundland government, and say, okay, like, we can't do this. Like, this is not, like, we're one person, it's too many patients. And they should be vocal about it. But the problem is with the nurses and doctors and everybody that I've spoken to inside the system, when they speak up about something, or if something seems like it's not quite right, their jobs become in jeopardy. And I
exactly.
know a lot of you people out there think that, okay, well, they're just doing it because it's their job. But a lot of them, if they leave their post, then more people are going to die, right? It's like, okay, if you get
Exactly.
fired for saying something, then chances are that's one spot that's still not filled that might be able to do something positive for somebody in a dire strait. So it's a double-edged sword, but it's like the conundrum with part of it is, how do you find a safe way, or find a way that you can allow the medical and health professionals to talk without fear of punishment for being
Reprisal.
vocal?
Yeah,
Yeah.
yeah. It's a
So
no-win situation.
exactly, it's a lose-lose, right?
Yeah,
The hospital staff are silenced. They can't say anything. It affects the patients. The patients are saying things.
yeah,
Some patients are concerned if they say anything, they're partially going through treatments and stuff, that if they say
exactly.
anything, that their doctors are going to treat them differently. And like, we're not here saying that there's a problem with doctors and nurses. There's a lot of great doctors and nurses out there,
Absolutely.
right? What we're saying is that the systematic failure of our provincial government is leading to numerous deaths and multiple people dying even in the emergency room, right? And that this can't continue. But Mary, we're getting up to be almost an hour now, so I'm going to thank you so much for joining us today. Please read through the messages, because some people might have some questions for you and little
Okay.
words of advice and support. And I look forward to seeing you again. And thank you so much.
And thank you for the time.
You are the best. Take care. See you soon, Mary.
Thanks. Bye.
Bye. Wow. So just while we were talking to Mary, there's been some comments that were made in our news feed in particular about the fact that there's been people that have lost their ambulatory business. Mary B. Stringer says, I know a family run ambulance that was one of the first on the island that lost business to the government takeover without any questions. It was a sad day for the family, that it was respected and for generations. So why is our government allowed to be able to public something like that without having it tendered? Mary, I'd like to talk to you in the future. So anyway, we're going to keep on our mission to making Newfoundland healthier again. Please God. I'm open to sharing your story. These all matter. It applies pressure where pressure is needed in order to be able to promote positive change. Without health, we have nothing. Everything hinges on our ability to be able to wake up every morning, take care of our families, go to work, and do this thing that we call life. So um, please like and follow Together for Newfoundland and Labrador. The fine crew over there are in the process of setting up a protest here in Newfoundland for June 1st. I am going to handle their public relations and give them as much support as I possibly can. When you got a bunch of 73-year-olds that are willing to hit the streets, and it sends a big message that you young fellows need to get off your couch now and support everybody, because if our seniors are out there advocating because they're concerned about what's happening to their peers, their families, their loved ones, or children, then it's a big deal. Signing out today. Love you lots from Raven here in Newfoundland and Labrador. Thank you so much for always chiming in, always being supportive, and for sharing. Please share this video far and wide. And if you'd like to share your story, please send me a private message. God bless. Happy Sunday. I love you all.